Good evening and welcome to our event this evening when we're talking about caring for the caregivers. My name is Cynthia Osborne, and I'm the director of the Child and Family Research Partnership at the University of Texas at Austin and its LBJ School of Public Affairs. And we're so grateful that so many of you are joining us this evening for this important conversation. I wanted to just thank a few people before we get started for pulling us all together and making this possible. First, I'd like to thank my colleagues at the University of Washington. It was they who initiated this study, and we were able to participate with them. And so I just wanted to make sure to recognize the great work that Jennifer Otten and others at the University of Washington have done. Now, my team here, Michelle Gibson, was the person who was instrumental in helping us to partner with so many child care providers across the Austin community. During that time, I think that those of you who may have interacted with her, she was Michelle Gutierrez and now is Michelle Gibson. And also thank you to Eileen Dunn, who helped to coordinate this event this evening. But I really want to thank the child care providers who gave us their time and feedback and energy to help us to learn more about our caregivers who are providing for our most precious resource, our little children. And so thank you for the time that you gave. And we had this event at this evening, this time, so that folks may be able to be off work. And we want to make sure that the child care providers are part of this conversation. But I know that this is a very difficult time, especially for those who have little kids. It's time for dinner, it's time for bed, it's time for baths. So thank you for spending your evening with us. And I would like to encourage you to put questions in the Q&A as we go forward. I will save time at the end to make sure that we can address some of the questions that folks have. I would also welcome you to use the chat function to share with us who's here with us. I know that folks continue to come in. I see the participant number going up. And there were over 400 folks who registered to join us from both the Austin area, the greater Texan area, and even beyond. So tell us who's here so that we know, and especially let us know if you are a direct service provider working with our children, either as a program administrator or a direct child care provider. Again, thank you for being here. We will provide more information on this, but we are offering certificates, the training certificates for the child care licensing. And if you are someone who needs that training in order to help to continue to renew your child care license, we will provide more information and so that you will have that and can access it. So again, welcome to everyone. Thank you for putting your information in the chat, and we're so glad that you joined us. I'm going to share my screen and go through some slides to help tell a story about how we can care for our caregivers. Let's see if I can get my slide to work. So hopefully this is showing up for everyone. So this is a topic that is of so much importance. We spend a lot of time thinking about programs to support children. We spend a lot of time thinking about programs to support parents. I've been involved in evaluating home visiting programs in Texas and elsewhere. And I would say that we spend not enough time thinking about how we can support those who are caring for our children when they're not with their families. And our child care providers provide such an essential function for our economy, for our society, for the well-being of our children. And the pandemic has certainly laid bare how important they are. I don't know how many of you are parents of young children, but every day that you were without childcare, I'm sure that you saw more and more how essential it was. And our childcare providers have struggled over the past year and a half like no other group, trying to keep their doors open, remain essential workers, but care for themselves and their children. All the things that I'm sharing with you today are actually things that occurred prior to the pandemic. And so what I'm sharing with you is not always great news. And there was a lot of struggle that occurred prior to the pandemic. And I'm afraid that the situation might be even more dire at this moment. And so whatever we can do to support our caregivers, I think that we should definitely all get together and do more. So I think most of you are aware, but our early care and education workers are some among the workers who are paid some of the lowest wages. And because of this low wage and other working conditions, the rates of turnover, of job turnover, is actually quite high. We know that wages and money are associated with health and well-being from lots of different studies, that people who have more money have longer life expectancy and so forth. And our child care workers, if we look at the median hourly wage of our child care workers in 2019, across the United States, it was about $11.65. It was slightly more than that in Washington State and less than that in Texas. But across the US, the turnover rate is between 25 to 30%. And any of you who are on here who run a childcare facility know how difficult it is to find folks who both have the commitment and love for the children and the skills and capacity to care for the children in the way that they need to. So this turnover has real costs, both financially as well as in human capital and for the well-being of our little ones. And I wanted to just show you the minimum wages that were in effect over different time periods, because what this study did was to take into consideration the changes in wages that were scheduled to take place based on changes in minimum wage across states, so that we could really start to understand the causal impact of a change in wage on the health and well-being of our childcare workers. And there are 4 time periods of our study, and you can see that in Washington State and in Seattle, they were increasing their minimum wage by statute over this time period. And the Seattle area actually increased it significantly more. By the end of the time period, it was up to $15.75 an hour. And in Washington State, it went from $11 to $13.50. Unfortunately, here in Texas, we were the control site. The folks in Washington had a pretty good idea that Texas wasn't going to increase its minimum wage over this time period, and we didn't. And so our minimum wage in the state of Texas is the federal minimum wage of $7.25. And so we wanted to understand how these change in wages might also be related to improvements in health and well-being of our childcare workers. And there was some work that had been done to anticipate a little bit about what happens to childcare centers when there are changes in labor costs. As you know, the cost of labor is the single greatest cost for any childcare facility. It takes up nearly all of the costs. And so it could have significant ramifications for being able to actually operate your childcare facility if your reimbursement rates and other sorts of fees are not increased over that time period. And so there was some concern of how do you balance the need to pay our childcare workers a more fair wage, much higher wage, with the need for our child care center operators to actually keep their doors open. And in the Seattle area, because they were increasing their wages over this time period first, we were able to learn from them what actually happened. And so first, we did see that there was an increase in the wages that were paid to workers, meaning that prior to the statutory increases, workers were being paid below that amount. And so some workers did experience increase in wages, especially as the wages went up to closer to $15 an hour. And the child care providers, the center operators, had to compensate for that. Some increased costs to families, some reduced the number of subsidized slots that they would take, some cut staff hours and training and went from offering full-time positions to more part-time positions with fewer benefits. And some increased their child-to-staff ratios, getting closer to the maximum that was allowed. And so these are trade-offs that child care providers shouldn't have to make. We need to make sure that we have an industry that allows our providers to be paid a wage that they deserve and earn, and for our child care center operators to be able to afford to stay open, and for our families to have access to affordable care. So these are definitely concerns that need to be addressed, and the only way to really address them is through additional public funding. We'll get to that a little bit later. But what we wanted to understand is not necessarily what does this increase in wages have, what's the impact on the centers themselves, but more how does that actually affect the health and well-being of those who are caring for our children. And tonight I'm going to share mostly about what we learned by surveying and talking to the child care providers so that we understand where they were when they started and how their health and well-being changed over time. And whether this increase in wages or changes in wage policies actually improved worker health. We also looked at how it might impact the environments, benefits, wages, benefits, and other sorts of things. I'm not going to focus on that tonight, but I'm going to give you the answer to the questions. Is that the health status of our early care and education workers is somewhat mixed, and there's some troubling things that they have told us that are cause for concern that we need to pay attention to. And unfortunately, the changes in the wages that we saw were not large enough to really see substantial changes in their health and well-being, at least in the time period that we were observing them. It doesn't mean that the increases in wages aren't important, but it means that they need to be even more substantial in order to see the real requisite changes in health, or other things may need to change as well. So my colleagues at the University of Washington worked with the Robert Wood Johnson Foundation and others to launch the Child Care Culture of Health study. And it was a natural experiment, meaning we took advantage of this increase in the minimum wage policy that was occurring both in Seattle and outside of Seattle in South King County in Washington State. And again, Austin, Texas was the control site. And at the beginning of the study, we enrolled 49 child care centers, 366 workers across all sites. We did not include Head Start centers or public pre-K centers because their wages are actually determined by different standards and not necessarily based just on the open market. We collected data via surveys and observations at 4 time points, and we also held focus groups. This is what I showed you before to just kind of put in perspective the surveys that were done at 4 different time points, and the focus groups that were conducted at 2 different time points, both with the teachers and the supervisors at childcare sites in all 3, Austin, South King County, and Seattle. And again, just a huge thanks to the child care workers who gave us their time by filling out surveys and sharing what they did with us during focus groups. So just to give you an overview of who was in the study, across the 3 sites, there were 366 workers, like I said. About 144 came from Seattle, 98 from South King County, and 124 from Austin, so pretty evenly distributed. And the median wage are represented here, much higher in Seattle and very similar in South King County and in Austin. And if you can see some of the characteristics of our participants, they were mostly female, about 62% white, but as is applicable across the country, our child care workforce is disproportionately women of color. 21% were Hispanic, 11% were Black, 6% Asian, and 14% reported that they were more than one race. Among the folks who we talked with, 80% were teachers. We also had program directors and folks who identified as something else. And I want you to keep this statistic handy when you look at that median wage again. 65% of our sample had a college degree or higher, even though the average wage was only $15 an hour. And so $15 an hour is equivalent to about $30,000 a year. That isn't, it's not nothing, but it's still with a college degree, this is what our child care providers are earning. On average, they had about 10 years of experience. Nearly a quarter were on public food assistance, and 10% reported that they had no health insurance. Many of our child care providers had health insurance through a family member rather than their center, however. So just to think about some of the characteristics, we asked a host of questions about chronic disease, physical well-being, emotional well-being, stress, food security, and other sorts of things. And on average, the child care workers across sites, and there were not big differences across sites in these sorts of indicators, but on average, their chronic disease and physical well-being was either similar to or slightly better than the US population, and in some instances, other studies that looked at early care and education workers. So about a third presented as obese, 27% overweight, and this is close to what the US population looks like. So about 72% of us are overweight or obese. That number may have changed during the pandemic around my house. And our EC workers in other studies have slightly higher populations. So our populations were relatively healthy, about similar numbers as the US population said that they had had diabetes, and substantially lower proportion of our EC workers had been diagnosed with high blood pressure. But when we looked at depression and we asked them to fill out a depressive symptoms scale, which is highly used and validated, 40% presented with clinically significant depression. And this is much more common among women who had lower levels of wages. And so this is in comparison to about national averages of about 20% for low-income women. There was a study that looked at nursing home employees, about 26% reported depression. Another sample of early care and education reported 25 to 36%. So the levels of depression were substantially higher. And remember, this was all prior to the pandemic. And when we looked at issues such as stress, the rates of stress were similar among our population, slightly higher, but somewhat similar as another study of family home ECE providers. And there were the scales on the mental health subscales rated lower than 84% of our population. But the lower the wage of the workers, the higher the level of stress. And this is at the beginning of the study again. When we looked at health behaviors, by and large, our sample was very healthy, or at least engaging in healthy behaviors. They're eating fruits and vegetables 2 to 3 times a day, which is similar to another study. And 86% listed discussed their aerobic activity, and it meets the recommendations of the U.S. national level. And this is much, much higher than another study of EC workers. Both Seattle and Austin are known to be outdoorsy places, so that could be part of what's going on there, but there was a high level of aerobic activity. But we also looked at food insecurity, and food security or food insecurity is a very serious issue. And among adults, their levels can be quite high because, and much higher than they are among children. Adults will typically go without their own food, cut back on what they eat in order to provide more for their children. Remember, these are the child care providers that are working with our kids every day. And they had a series of questions that would put them on whether they're in very high food security with no problems to very low food security, where they're disrupted because of lack of money or other access to food. And when we look at our sample, there are quite a high number of folks who reported that they were food insecure, with 20% reporting very low food security. And again, the lower the wage of the workers, the more likely it was that they were reporting that they were food insecure. And this is more than three to four times what US households report. There was a study of low-wage nursing home employees that found that they had a high proportion of their workers who were food insecure. But this is a very high level of food insecurity. And remember, 23% report that they were on food assistance, such as SNAP. But still, this number was reporting food insecurity. And when we looked at the correlation between food insecurity and depression, the correlation was statistically significant and quite large. So on the orange line, that is this is the group of folks who said that they had normal to high food security. They're doing okay, all the way to the folks in this quadrant who said that they had very low food security or low. And the blue line is correlated with that. So you can see that the levels of depression are lower among those who have better food security, and the levels of depression go up with the levels of food insecurity. So these are things that are going hand in hand. But I feel that the survey data that we got was only one part of the story. Talking to our providers really helped to round out this understanding of these surveys for us in important ways. And again, we met with the kind of supervisors and program directors, as well as the teachers. And these are the words from folks here in Austin. We also held focus groups in Washington State. But you can see that they told us that they face stressors that really do affect their mental well-being and sometimes intertwine with their physical health. I'm not going to read all of the quotes that we have on here, and happy to share the slides with folks. But there was a real sense of feeling undervalued, of kind of being a strain on their emotional capacity. And there were discussions about the classroom structures and routines that also made it very difficult for them to feel valued, like being able to just go to the restroom when they needed to, and how they were treated by some of the other parents that come in and leave their children with them every day. So one Austin Center director said, they were talking about the mental well-being of providers. It has a tremendous impact in the classroom for the children, how providers interact, what they do, what they don't do, what they choose to do, how they choose to talk to parents that day, how they interact with the other staff, the way you carry yourself and the way you are. I mean, the impact is tremendous. So it's just talking about how when the child care teachers, emotional capacity, mental well-being is impaired in any way, this is going to have lasting impacts, ripple effects throughout. And we know that these are iterative processes that when we are having when we're feeling emotionally drained, that when we interact with others, this is kind of builds on that in a negative way. So here's some quotes that really talk about how they were feeling undervalued. Parents come in with this attitude that I'm just your child's babysitter. It makes it even worse. It makes me question, why am I here? Another said, under parents' perceptions and attitudes is our world's attitude about how children are valued and how women are valued and how care and education are valued. It's all part of feeling undervalued. The director said, I really think that we are looking at a group of people who are so devalued in what they do that it has to have an impact on them. I really do. Even those who maybe are getting paid a little bit better, I think families don't necessarily respect or value them. Our society doesn't. Sometimes our own institutions don't. I worry about that. I really do. And a few selected quotes with regard to emotional capacity. One teacher says, you're dealing with all of this stuff from parents, the staff, the director, and then you walk out those doors and you have your own life. You have your children, your husband. It just never stops. The ability to recharge, they kept talking about, just really is so limited for them. ECE is very much an emotionally demanding job, especially if you have children with challenging behavior or a parent who's challenging. They talked about how sometimes they lacked others who they could talk to be able to get support and feedback about how to deal with some of their challenging behaviors. A provider says you're taking on other people's stresses. This was repeated again and again, how they felt that they were really the ones who had to take in all of this emotion from others and didn't have a lot of support for their own. You're dealing with one particular family, then another comes in and they're dealing with this. The next thing you know, it's all bottled up and you're just holding it in until you get to the point where you're about to explode. And it's not like we're mental health professionals or social workers. We're not psychologists or psychiatrists. We're dealing with issues that those professions are trained to deal with. And here's someone who's talking about their classroom structures and routines. This one classroom had a lot of transitions with teachers in the classroom. The classroom had been through about 7 or 8 teachers, including leads and assistants. I decided to go ahead and take on the position because these children had just been through entirely too much. It was a lot. I would sometimes have to call upstairs and say, I need to walk for a minute. Can you send somebody downstairs? I've gotten hit with toys thrown across the room, bitten. There's moments that I've just been like, I have to walk away. One day I just called and said, I need a day. I need a me day. And there were a lot of providers who talked about this idea that there was no place to go, that once they were in the classroom, legally, for safety reasons, they just cannot walk away. And they didn't always have that backup that they needed and when things were getting really rough. And most of them did not have mental health consultants or other sorts of support structures for these situations. All right, I'm going to move on to the second question, just about how things really changed over time. And what we do see is that over the time of the study, that there was a gradual increase in wages, but this occurred in Texas as well as in South King County and in Seattle. So it wasn't necessarily just related to our minimum wage policies. And these were the average wages, which would include those who were paid substantially more, along with those who had very low wages. So you can see that there was this trend, but it's not a huge increase over this time period, of this 4-year period. And when we look at depression, there was a decline in depression over time, but it wasn't different by different groups, and the decline was not significantly, it wasn't statistically significant. And so the pattern looks like it's going down, but really there's not much of a change over this time. When we look at things like stress, same thing. There wasn't really much of a change over time, and the differences between the groups stayed similar. This is another indication of stress. That one was mental well-being, but very similar sorts of ideas. And we see that stress, did decline somewhat, but that there wasn't a difference between groups, and the decline was not statistically significant. These are eating behaviors. Remember, we started off with pretty good eating behaviors. These are sweet drinks. I'm a Diet Coke addict, and so I think if I were in the study, it might be off the charts here a little bit, but there was really no difference between groups or over time in the eating behaviors. This is just one indication. And when we looked at food insecurity remained high over time, and it dropped a little bit more in Texas than in the other sites, which is kind of counterintuitive, given that the wages were supposed to be increasing more at the other sites. But again, these are only slight declines, and they're not statistically significant. But when we talked about kind of what it would mean to childcare providers if they were able to be paid more, and remember in Austin, there was no promise that wages were going to increase like there was in Washington. There was no statutory change. But one of them said, just being paid more would be a message that my work is valued, that children and families and women are valued. The work that teachers of young children do is not valued in the same way that some work in other sectors is valued. And that is shown by the wages, the salaries that people get paid for doing that work. You kind of go into this field knowing you're not going to make much money, so you kind of accept it. But if I wasn't married, I don't know if I could stay in the field. I mean, I definitely couldn't afford to live in Austin. When I went to get my bachelor's degree, I thought, well, maybe I'm going to go try to make more money, do something different. But my passion is in the classroom. This is someone who does not want to leave. But how do we keep her in the field when the wages are so low? We also talked about how their passion really is the thing that keeps them there. I'd say one of the challenges being an ECE is not getting paid enough. Like maybe you could be making more money elsewhere, but my passion is what keeps me at my center more than anything. This is a job you actually have to love, because you're not going to get paid. You have to have the passion and love the job to actually continue. Here's someone who says, we're raising the next generation of children. That's a huge issue that stresses me. It's really unfair when the stress we experience doesn't match what I'm valued at. Like when the respect and pay doesn't match the stress level. Like, what am I doing? But then a kid will look at you and you forget. But although we want people entering this field who have a passion for caring for others, that shouldn't be reflected in low pay. We should reward that and find ways to demonstrate that value that we have. So these are just a few other, I'm going to just skip through these quotes in the interest of time to kind of close out so that we have time for questions here at the end. But what we know is that the health of ECE workers is really important. We don't necessarily know how we can better support this health, and particularly in depression, mental well-being, and food security. We did find that the relatively small increases in wages did not seem to affect health over this time period. And we also saw that the health context of centers and the quality of care that folks were providing didn't change markedly over this time period either. So there's more coming. There's more studies that will be coming out of this work and larger ECE workforce studies, because we will try to crack this nut. But there are some recommendations that we draw from both the surveys and the focus groups and just our knowledge of the field in general. And the first is just simply there needs to be more money. The American Rescue Plan Act has provided unprecedented levels of funding for every state to try to decrease the amount that families have to pay. And states can use it to increase the salaries of workers. But we also know that states are challenged because the funding right now is only temporary. And so increasing wages has long-term implications for sustainability. And so cities are trying to figure out how you're going, or communities are trying to figure out how you're going to do that and balance that short-term and long-term needs. There are places that are stepping up, providing more pay for those who have higher levels of credentials. Remember, 65% of our workforce has a college education. And this, there are a lot of states in which they are incentivizing folks to get higher levels of education, but not necessarily paying much more, and that these two things need to go hand in hand. But in order to reduce the strain on our childcare providers, that providing professional coaching, mental health consultants, or other ways to help our childcare providers cope with the day-to-day stressors of caring for kids, as well as caring for the parents of those children, or interacting with the parents of those children, who obviously have their child's best interests at heart, but it's not always that easy to deal with 20 different parents all the time. The centers who have these floater positions seem to be able to provide relief to childcare teachers when they need to step out for a minute for either just kind of mental health reasons or bio breaks. This can be expensive, and so it's not something that all providers have or can afford, but it is a seemingly kind of vital role to provide greater support. There are some sites that use their dollars to provide on-site meals for both childcare providers, and the children, and that this might go a long way in helping to reduce the food insecurity that so many are experiencing. Among those that we spoke with, they talked about sharing meals together, about having healthy snacks in the kind of workroom, if you will, and that this was really something that they valued a lot, is being able to share meals together. There's different ways to think about kind of expanding or professionalizing the workforce, and to expand coverage for subsidized families. So anyway, I'm going to stop here, and again, just want to acknowledge the folks who shared their time with us and all of their experiences. We want to be able to hear from you and know if what we're seeing is reflective of your experience, and also to the funders who help to support this study. So I'm going to stop sharing my screen there. We will be able to provide more information to you and contact information, so that if you do have additional questions, that we are here to try to answer those. And I see that there are questions in the Q&A box, and there's some in the chat. So I'm going to start with the Q&A and see what I can do here, and then take, if you can put them in the Q&A, that will be great, because then they'll all be in one location. But if not, I can go back to the chat too. So again, thank you for letting me share that information that we have. And I really am interested to hear what you have to say here. So someone asked whether we think that in addition to the low wage working conditions and work environment, that might influence these health, and that might influence the health and well-being results. Let's see. Do you think in addition to the low wage working conditions and work environments might influence? I think that was, sorry, I misread that. Yes, I think some of what we touched on in the focus group results kind of speak to this, that low wages are just a symptom of this work environment and the value that they feel, that the wages themselves, are instrumental, foundational to providing for their families and themselves, but it signals to them that society doesn't value them. And they're also in often environments in which they have very little um, flexibility or autonomy, and we know that those are important characteristics of fulfillment on a job. Um, so let's see. Someone asked what kind of statistical tests were done for the food insecurity and depression findings. I found some moderating effects in my study, and I'm wondering if they might account for some of the lack of differences. So in the food insecurity and depression findings, that is the one place in which there is statistical significance. And there was regression analysis that was done in addition to just t-tests to look at the difference between the groups. But that is the one place in which there was statistical significance. But Amanda, I'd be happy to talk with you further, and my colleague Michelle can put in the chat the link to that paper so that you can read. I wasn't an author on that particular paper, but it seems like you might be really interested in reading that paper and specifically. So another person asked whether the patterns related to the health and well-being of staff are related to whether a child care program accepted child care subsidies or not. In this study, all of the folks accepted child care subsidies, some to higher degrees than others, but we did not look at the moderating effect of child care subsidies and or the number of slots. So that's something that we could look at, and I'm not sure exactly what the hypothesis should be. This is a stable form of funding for many centers, and it provides a mixed environment for our children and their families. But I'm not exactly sure what the hypothesis would be there, but that is not something that we looked at. And similarly, the idea of looking at whether there was a relationship between childcare quality and the provider mental health. Well, we didn't have an indicator of childcare quality. There was some observations of the centers and so forth, but we didn't have an empirical way to say that this is a center that had higher quality or lower quality. That wasn't part of this particular study. So it's a really good question. But it also begs the question of if you are struggling with your own emotional or mental health challenges, whether you're in the best position to offer the nurturing relationships that you know that you want to offer. We know with parenting that isn't possible. And so it's possible that it's likely that our child care providers are not able to as well. Let's see. Amanda asked that Texas is not a Medicaid expansion state. And Washington is. Wondering about how this affects the outcomes because this can have an impact on many factors. It sounds like you're doing a dissertation on this area, and I'd really love to hear more, Amanda, of what you're doing. And I could definitely see where Medicaid expansion is related to healthy behaviors and health outcomes, but we didn't see big differences across the site, so I don't think that the Medicaid expansion is explaining this particular differences in outcomes. Let's see. Did the child care providers who were depressed seek out support from counseling, friends, church, early childhood mental health consultants, etc.? We didn't ask that question specifically. In our focus groups, though, no one said, I'm depressed, and here's what I reported. The surveys were done separately, and I don't know who it was that indicated depression. But we did ask the child care providers how they coped with the stressors of their job and the types of support that they sought. Many of them did not have access to counselors or professionals that could help them with any of their issues. They talked about leaning on family and how important that was. They talked about needing to go out with other child care providers because these are folks who understood what they were dealing with. So through some sort of social events or happy hours or other things that they could get together and commiserate a little bit with folks, which obviously can be very helpful. But when you have clinical depression, that certainly is not enough. So they talked about ways that they tried to recharge on the weekends, the things that mattered to them, but very few seem to be seeking out professional help here. Let's see. Please forgive me, I've had to multitask. So I imagine this person is trying to feed their child, get their child to bed, put dinner on the table, and take notes for professional licensing. So kudos to you I bet you're doing all of those things. But she asked, you may have already addressed potential solutions. Our state is struggling with sustainable solutions to the problem of low wages. Are there any local level pilots that have found successful solutions that can be scaled or drive a direction for advocacy or policy? Well, there are various pilots, and we could put in the chat for you a link to an evidence review that we did at the Prenatal 3 Policy Impact Center on child care compensation, child care worker compensation. And right now, there hasn't been rigorous studies that have really told us what the exact right answer is. But there are states that are trying things like scholarships or tuition reimbursement or loan forgiveness. They're trying to do things that the state can pay for that doesn't impact the bottom line of the child care centers. So again, it's that trade-off of how do you increase the compensation of child care workers without putting a burden on the center itself that is often transferred directly to the household. And that's why we need more public dollars to help to subsidize these wages and or provide other sources of income into our child care centers, because it is such a public good. Louisiana has some interesting strategies to try to increase the wages of child care providers, which is being a state so close to Texas is one that Texas would actually pay attention to. Excuse me. I have some allergies today. So this person asked, would you say that the mental health and stress might be reduced when there's time for ECE teachers to convene a supportive community? Should mental health be too costly to provide? And I think that's similar to what I was just saying, that they were looking for informal solutions to recharge. They talked about how the focus group was something that was really rewarding for them, to just hear other people were struggling with some of the same challenges that they were. We provided a meal and childcare and brought folks together, and they stayed much longer than we had even asked for. We also paid them for their time because they were basically providing consultation to us, and we want to treat them like the professionals that they are. But that is a really important question about what can help. They also talked about some of the professional training that they had on trying to deal with difficult behaviors for children. And so providing supports in myriad ways, I think, is really the answer. No one reported that they had a mental health consultant that they were working with, but we know that this is an effective strategy as well. Cheryl is working on her dissertation. Congratulations, or I'm sorry. And you have read lots of things that parallel these findings, which is sad and reassuring to hear, but disappointing that we can't find a way to do this better. And you say that you think that the main obstacle in ensuring that child care providers are paid an adequate wage, or what do I think the main obstacle is? And I think that the main obstacle is twofold. One, we don't see childcare as a profession, as the essential element factor to our society that it is, in the way that public schools are. That if we thought of it as this profession, then we would treat those who work there as professionals. But it's also just today, it's about the margins, that the labor costs at a center are substantial. and that in order to increase the labor costs, we're going to have to reduce costs some other way unless we increase the amount of money that's coming into the centers. And so that's where public dollars, I think, should be spent, because families are already spending a substantial share of their income. Even those who get a child care subsidy are having to spend a substantial share of their income on co-payments and fees and so forth. So I believe that the only answer to this is an infusion of public dollars. And with the American Rescue Plan Act, we have an opportunity to test that hypothesis. So I hope that we do. This person says, having worked in a classroom for 13 years before moving to administration, I'm convinced that being in a classroom for 8 hours a day is not sustainable emotionally or physically, especially as teachers age. Yes, they talked about physically how hard it is to get on the floor and move around with all these little ones all day long. I'm in the process of recreating my teacher schedules to give teachers a day or half a day off each week and planning time each day. They talked about not having planning time and that they were really using their own time for planning, that there was no time that they were paid for this, but they were expected to have lesson plans each day. I was a former public school teacher. I know that that is the case for public school teachers as well. If we look to skilled labor that is organized under a union, we can see there are lots of avenues for increasing wellness, security, and professionalism in the EC profession. Is there any organization or entity that advocates directly for improving the lot of dedicated preschool teachers? So I would actually like the folks in the chat to respond to that question, so that you probably know the organizations that best seem supportive. There are organizations across the country. Child Care Aware is, I would say, probably the largest one that advocates for the kind of better situations of both quality childcare and the workforce. And there is a research center at Berkeley that does an amazing amount of quality work looking at the workforce issues. So I really encourage you to visit both of those. This is a question that's always a little embarrassing for Texas. How much training does a child care worker have to have before being hired? How much is required per year in Texas? So again, I would love it if my colleagues in the chat can make sure that I am correct on this. Kathy McHorse, can you please tell us all the correct answer? But my understanding is that there's 10 hours of training that is required in order to be able to be a child care provider. But there are different sorts of training schedules or that are required for additional sorts of certifications. So that you obviously the higher the level of certification and the more training. But I will make sure to get that appropriate information to you so that I'm not saying anything that is incorrect. So 24 hours of pre-service in Texas. Thank you very much for that. And I stand corrected. So we're coming to the last 5 minutes, and I'm browsing the chat box to just make sure that I didn't miss anything. I love the fact that there's someone from Kyrgyzstan here, which means that it's tomorrow morning where you are. So hopefully tomorrow's a good day for everyone. And let's see. It looks like most of you who had questions here moved them over to the Q&A box, so thank you for that. And it's so great to see so many folks who are here and the way that you've been participating and encouraging each other. That is, this is just a group of people that really make me feel good about the work that I'm able to do, to be able to work with you and to serve you in any way that we can. So again, thank you to the participants who shared their time and feedback with us, and for the work that they do and you all do to serve our most precious resource, which is our children, and supporting the parents who need you so much. And I wish, like anything, that we could show our child care providers how valued they really are. And we will find ways to do that. I know that we will, but it's discouraging to know that people who give so much sometimes do not feel like they are valued in that way. So with that, I'm going to close out. And again, thank you so much for the time that you've given us today. I wanted to just put in a little bit of a shameless plug for an event that we will be holding on October 7th. It's going to be virtual. We hoped for it to be in person, but it will be virtual. And it is our National Prenatal to 3 Research to Policy Summit, where we'll be talking about what states can do at the 51 state level to try to create more integrated prenatal to 3 systems of care. Our child care providers are such an integral part of that system to care, and how they can work with healthcare providers, social service, education, employment, centering the family and building the system of care around them. So please register for that summit if you haven't. And thank you all for your time this evening. And thank you for the work that you do. Good night.